Hello, everyone. I'm Kate Still. I'm the scientific director for the foundation, and I'm here today to just talk to you briefly for about 5 minutes about the new and upcoming Phelan-McDermid syndrome data hub and give you a little bit of background on the data hub and some of the intentions we had with creating the data hub and some of the things that we hope to gain from it, which might be also reasons that you might be interested in joining the data hub in the future. So first things first, what is the Data Hub? It's an online platform for us to collect and share medical information about Phelan-McDermid syndrome with researchers. So this includes things like genetic reports, answering general health surveys, and you'll also have the option to log and track things like medications and activities and symptoms and things like that. And the Data Hub was really designed to be an improvement on the previous international registry to have shorter surveys that are more standardized. And the goal was really to make it very easy for families who are first joining to enter in all their information, easy to return to it later to update it, and also make it very easy for researchers to analyze this data by having really standardized responses. So that was one goal of the Data Hub. Some of the other things that we think are benefits of the Data Hub is number one, furthering research. So a lot of the research surrounding Phelan-McDermid syndrome are these studies that you may have heard of called genotype-phenotype studies. And so they're focused on specific genetic alterations in the genome of people with PMS and looking at how that connects to specific symptoms or outward manifestations of the disease. And so the Data Hub is a place where we can collect a lot of both of those pieces of information from a wide variety of people. So if you are somebody or somebody in your family with PMS has a more rare genetic alteration, this is a good way to be represented if you are underrepresented in some other studies in PMS. Because we're really hoping to collect a wide range of information. And pharmaceutical companies have also reached out to us to look at registry data and other data like this to see what the PMS population really looks like, to see if they want to test their drug on that population. So that can be really helpful for that as well. Another reason why we designed the Data Hub was to keep an accurate count of people with PMS as best we can in conjunction with the number of people in the PMSF membership. And so this is one way that can really help us do that, to continue to have great advocacy and understanding of Phelan-McDermid syndrome and its prevalence. Another reason that we designed it was to give us a way to easily contact people who are interested in research studies. So if you join the Data Hub, there will be an option to be contacted about future studies. And these could be things like surveys or clinical trials. And although we will certainly advertise for these things on our website and on social media, this is just one way to be directly contacted. Another thing that we wanted to highlight is that because we chose standardized surveys, we're really hoping that other groups, including neurodevelopmental disorder groups and rare disease groups, will use these surveys. We already have some confirmation of some of that. And so that can be really helpful in research to pull out common themes and ways that these disorders are differentiated. So if you have a lot of genome and symptom information from a lot of these different disorders, you can start to pick out things that could cause similar symptoms and places where these disorders diverge. And finally, we're really hoping this is a place where it can help organize medical information for families. We know that a lot of these reports can be cumbersome to keep track of, and so we're thinking this could be a home for a lot of this data if you so choose. So that concludes this introductory chat about the Data Hub. And we are going to be sending out some more information soon about more specifics about how to use the Data Hub. Some of the, again, the reasons why you may or may not want to join, It's all completely voluntary, and we will be posting some of that very soon. So thank you so much for your time.